Let's talk about mastitis in your rabbits. How do you prevent it? What is it? And how do you treat it if you get it? Hey guys, welcome back to another Slightly Rednecked video. Again, my name's Chris, and if you're not familiar with this channel, I help you to produce your own meat, eggs, and vegetables from your backyard, your balcony, your deck, your garage, or even a spare room in your house if that's the way you want to do it. Today we're talking about mastitis in rabbits. I had a couple of questions come up about this recently, and I thought I'd just address it in a video. Let me start off by saying I don't have this problem with my rabbits. I don't have a rabbit that has mastitis. I've never really had to deal with it much, but I am familiar with it, so I'm not going to be able to demonstrate it, but I am going to be able to talk about it and hopefully explain it well enough that you'll know what it is. Okay, there's two different types of mastitis, and if you're not familiar with what mastitis is, it's basically a blockage of the mammary glands. So it can happen in any animal out there. Even people can get mastitis. It's a common thing that can happen. It's a blockage of the mammary glands. Usually it's not a problem unless you have as you can imagine, nursing doe. She's got kids that are trying to nurse, kits I should say, that are trying to nurse. And it blocks the mammary glands so they're not able to get milk production out of that. Now it can lead to some pretty serious issues. There's basically two different types of mastitis though. There is cystic mastitis or septic mastitis. Cystic mastitis is caused because there is, a cyst of some kind, usually a benign cyst. It could be malignant, who knows? I mean, it could be either way, but there's a cyst in the rabbit's mammary glands, in their breast tissue basically. And when they become pregnant and whenever they have kits, then they start to try to produce milk and it blocks it for some reason. And usually the area will then become swollen because the kits will still try to get milk out of that area, but they're not able to. So therefore it becomes swollen, it becomes enlarged, it becomes a problem once they have kits and they're starting to produce milk. Hopefully that kind of makes sense. There's really not much of a way to treat mastitis if it's cystic aside from removing the cysts. So you would have to get like a veterinarian involved. And honestly, it's probably not worth trying to do if this is, if you're breeding for meat rabbits. It's probably best to just don't breed that doe. If they've got cystic mastitis, just don't breed her. You could keep her around as a pet. You could call her out of your herd if you need to, but it's best not to breed her at that point. Now, if it's septic mastitis, that's caused by a little bit different. That's usually an injury to the teat area, and then there's some kind of infection that's started on there. Usually it's staph infection, or it could be streptococcus bacteria. Hopefully I'm saying that right. I'm not a biology expert necessarily, so I get those terms mixed up a little bit, but staph is probably the most common type of infection that they get. So they'll have some kind of injury, a scratch, a scrape, something like that. And then they end up getting an infection in there. And it'll be symptoms that you're normally associate with an infection. So they're gonna be lethargic, maybe running a little bit of a high fever, not wanting to eat or drink, those kinds of things. It'll look like just like any other kind of infection. You'll also notice that the area is swollen, it's red, it's inflamed. It's not good, of course, for the kits to be able to try to get milk from the mother when she's got that infection. So the way you treat that is how you treat any other infection, with antibiotics. And what you should probably do is go to a local farm supply store, pick up a penicillin or a general broad spectrum injectable antibiotic, and then it should tell you on there how much you need to use to treat your rabbits based on, it may not say for rabbits, but it'll be based on weight. So much, volume per weight of rabbit. And you'll want to treat them for a good 4 or 5 days after the infection is gone, daily, to make sure that you get rid of that infection. The best way to prevent mastitis, of course, there's not much you can do for cystic mastitis, but it's kind of on the rare side. The best way to prevent septic mastitis, there we go, is with husbandry, keeping things clean and making sure there's not ways where rabbits can injure themselves. Now, I have had people tell me that wire nest boxes, like what I use, let me get one out here, I'll show you. Let me dig it out. These are the nest boxes I use. It's just a wire cage basically, and I line it with cardboard, straw, and whatnot. And there are some kind of sharp edges on the edge if you're not careful. And those can cause injuries to the does, and that can lead to mastitis whenever they start to have their babies. They're climbing in and out, and they can end up scraping themselves on these metal edges. So it's best to make sure this is as smooth as possible. I've never had a problem with mastitis. It's never been an issue for me. But I have had other people report that the wire nest boxes are causing injuries to their does, which then can cause mastitis. So it may be good to put something like a piece of plastic over the top of this. Now the rabbits are probably going to chew on that, but if you can put something smooth there to where they're not going to scrape themselves when they're getting in and out of the nest box, that can help prevent it as well. But again, keeping things clean is the best way to prevent it. All right, so I am actually of the opinion that it can be a genetic trait that they'll be more susceptible to mastitis than other does would be. So if you have a doe that gets mastitis on a regular basis, again, it may be best to just go ahead and cull that doe out of your breeding. Or, you don't necessarily have to, again, cull does not necessarily mean kill. Cull just means remove it from your breeding. So it could become a pet rabbit. Just don't breed it again. I think that's probably your best practice. Now, it could be just a one-time issue. The doe had an injury of some kind. Once you get the infection under control, everything's fine. You may end up having to, it may abscess. If you have a septic mastitis, you treat with antibiotics, get rid of the infection, but it may still abscess. You may have to drain that, lance it and drain it to get all the infection out of there. And if it's just a one-time thing, then it's just a one-time thing, no problem, everything's good. But again, if it's a reoccurring issue, it's probably best to remove that doe from your breeding plan and not breed her any further. So hopefully I got that covered well enough for you guys. You understand it. If you've had problems with mastitis in the past, or you've got a good treatment plan for it, leave it in the comments down below if it's something different than what we've talked about. But generally speaking, like I said, it's just an infection. You treat it like you do any other infection. Antibiotics is generally the course, and once it's cleared up, it should be good to go. So thank you guys so much for watching this video. Hopefully you enjoyed it. As always, God bless.